So here you go. So this is the topic I'm going to talk about: immediate effect evaluation of acupuncture for shoulder pain with a single acupoint or a single needle, as normally we use in acupuncture terms. And as I'm all the way from Brazil, and we have friends from all over the world, I'm going to do my presentations in different parts. First, I'm going to talk a little bit about Chinese medicine in Brazil, just a brief introduction. Then I'm going to talk about, in a broad sense, the idea on how to treat disorders with pain, some principles. I'm going to talk about shoulder, and then I'm going to present the topic using my research as a reference. Okay, so this presentation is based on the thesis that was submitted some years ago for my PhD at Shandong University of Chinese Medicine. And my tutor was Professor Gao Shujun, which is nowadays the president of Shandong University of Chinese Medicine. Actually, he is in the real moment of retiring, as he's completing 60 years. So they officially have to do that. And he's very famous in China, and he even lectured in US and Europe about one of his specialties, which is called the Yizhen Liaofa, or one needle technique. And he draws from Ling Shu on the ideas in order to present his information. And he's also becoming more and more famous for the use of a method called Qi Liao, which is naval therapy that combines the use of powdered herbs and moxibustion for the treatment of many diseases, focusing basically on the naval area. So instead of doing salt moxibustion for improving health, he basically uses herbs and moxibustion, or sometimes just herbs in the navel. So this is the guy who really inspired me. This on the left is my picture with him when I first went to China. This was the year 2001. And on the right, a few years later, when I was awarded the PhD title, and I had the great honor to have him as my tutor. Okay, so just as I mentioned, a brief introduction about the Chinese medicine here in Brazil. And I forgot to mention, as you noticed, I'm not a native English speaker. So if there is any doubt about my English, please mention on the chat. If there is any question, I'm looking at it and I can try to answer as quick as possible. So acupuncture and Chinese medicine in Brazil have a long history, maybe not as long as in US and other countries, but it has a long history when we compare the idea that people have that acupuncture is really new here. And this presentation aims to present the information related to the use of acupuncture by Brazilians and the education and the relations of Chinese medicine and acupuncture, and how it got into what we can say nowadays a little bit of mainstream. A lot of people like and enjoy the use of acupuncture. So what some research have found out is that acupuncture began to be practiced here in Brazil when the first Chinese migrants arrived here, and they were brought here by the Portuguese emperor. We were colonized by Portugal, so the Portuguese emperor here in Brazil, they brought some Chinese to prepare the garden and also to plant some tea here. And these people, they were also practicing some forms of acupuncture. In 1908, the Japanese immigrants, when they arrived in the official migrants, they brought also acupuncture, a little bit different. As we know, they have the Japanese acupuncture system, but it was not spread. It was only for the Chinese at first, and then only for the Japanese at first. They only for the colony, not for other people. But in 1958, German physiotherapist Friedrich Spath, he brought acupuncture in a more official way, as we can say, and he began teaching it and spreading it from Rio de Janeiro and São Paulo. And in 1972, the Brazilian Association of Acupuncture was founded. Nowadays, this association is still existing, but not as a representative of the class, but more as a school still teaching acupuncture. And now, when we say that there was this German guy bringing acupuncture to Brazil, not straightforward from China to Brazil, this means that the acupuncture that started being practiced here in Brazil had more, we can say, an European influence. So we had more French influence or French acupuncture style being practiced here in Brazil instead of the Chinese way or the information really based on the classical. Okay, so and it's believed that just in the state of São Paulo, where I live, which is the largest state in Brazil, there's a number of about 50,000 acupuncturists. It's not officially, and it's not totally correct to say that 50,000 people are practicing acupuncture, but we can say that in any way they had some kind of study related to acupuncture. So this comes from the State Union of Acupuncture here in São Paulo. And in the whole Brazil, some numbers that appears mainly when we go for politics and we try to get acupuncture regulated. The number used is 250,000 professionals working with acupuncture or Chinese medicine related methods in any way. And as there is no official list of practitioners, in US we have like NCCAOM as the national certificate, you have the state agency and so on. Here in Brazil, there is no official board for acupuncture, but there is some counting, as I mentioned before. But as there is no official list of practitioners, there is also no official list of schools because there is no regulation of acupuncture. But when we do a search on the electronic database of the Ministry of Education, there are a total of 250 different institutions offering acupuncture program in post-graduation level here in Brazil. So we can see that it's spread in a very important way here in Brazil. I'm not saying that the level of education is good, the level of the education is great, but we can see that there are a lot of institutions offering acupuncture programs here in Brazil. And until very recently, Chinese medicine education was basically presented in two different ways. We call it open courses or free courses, which are open to any people. They must have just a high school level of education. And it's a program that does not entitle any kind of degree. It's just an education program. But as I mentioned, as there is no regulation, people can practice. And we also have the post-graduation courses, which are in between the level of undergraduate, the level of a degree, and the master program. It's in the middle. And they must have a minimum normally of 1,200 hours. So people that have a bachelor degree in health profession, like being a physician or a nurse or a physiotherapist or a pharmacist and so on, they can go further studying acupuncture and receive this certificate. Once again, not a degree, but things have just changed a few years ago. And it's with great joy and pride that I, as a president of Brazilian College of Chinese Medicine, ABRAMAC, after many years of hard work, we obtained for the first time ever the authorization from the Ministry of Education to offer 4 degrees related to Chinese medicine: acupuncture, herbal therapy, massage therapy, and the herbal therapy related, herbal therapy on the e-learning platform. That's important to say that, oh, why didn't you apply for Chinese medicine degree? That's the thing. Here in Brazil, until now, the word medicine is attached to Western medicine. So my idea was to break in different branches. So acupuncture, herbal therapy, and massage, and people can study one branch and then go for further education in the others, and they can have the post-graduation program. So this is how education is growing in Brazil. So I started just mentioning about the Brazilian College of Chinese Medicine. We are the largest Chinese medicine institution nowadays in Brazil, and we have the main building, the headquarters here in São Paulo, and we have branches in different cities of Brazil, and a total, including presential classes, e-learning, we have about 1,500 students. So this is just a few pictures. Some of the students now already DAOM from 5 branches. They visited us, they did their clinical rounds here. So this is just some parts of the college, the library, the herbal room, the massage room. So this is just a brief introduction and presentation. Unfortunately, until now, as I mentioned, there is no regulation of acupuncture or Chinese medicine. There is one law project that has passed from the deputy chamber and now in the Senate. So it moved from the lower to the higher chamber. And we hope that this bill, this law project can be approved as soon as possible. But here in Brazil, the law goes like this. Our constitution says that no one shall be compelled to do or refrain from doing something except by the law. So until there is no law, anyone can practice acupuncture. And I hope there is a law that says who can practice acupuncture, who must have some minimum level of education, because a free practice is good because no one controls it. I mean, physicians do not control it as they normally try to do, but people with not a good education, with not a good background, and also can practice. So we need to understand this situation. And as I mentioned, it must be pointed that during the past years, the Federal Council or Board of Medicine has been trying in different ways to control the practice of acupuncture. They want that acupuncture should be practiced just by physicians. And hopefully this changes with the regulation and there is no more pressure from them. Okay. And just to point, besides the private practice of acupuncture, the use of acupuncture was introduced in our outpatient information system. And I'm not sure if it's known there in US, but here in Brazil, we have something called SUS, which would be translated as Unified Health System. And anyone here in Brazil can receive free treatment. And acupuncture is included on this system. So if you go to public hospital and they have acupuncture there, you can be treated for free. I'm not saying it's a totally fast and easy to get treatment, but it's for free. So if a foreigner comes here in Brazil with no insurance, for example, he can go to the public hospital and receive free treatment. So this is a little bit of a good thing about this situation. Okay, so moving a little bit after this brief introduction. Normally when I lecture, when I present some class, I like to start with this quotation: reviewing the old and learning the new can become a teacher. And actually this fourth character from the second line, shi, this can mean a lot of things, including related to teacher, as Confucius, Kongzi, is also really associated with education, but shi can mean someone that practice some kind of job or occupation. So for example, if I get the Chinese characters for acupuncture and add this shi character, it means the acupuncturist. So we have zhenzhou for acupuncture moxibustion. When you do zhenzhou shi, it's the person who practices it. So what I'm trying to say is that reviewing the old and learning the new, this is what we need to do in order to improve our profession. We need to review the information from the classics, but we not be blinded by the new information. So the previous doctor presenting about research is something new that we need to embrace. As I see Chinese medicine, I should not ignore the classical information and just look at the new. But I also cannot just look at old information and ignore the research. I need to understand how to balance this. And this quotation from Kongzi really inspired me. And the motto of my college is tradition and modernity. We need to balance this traditional information and the new information. That's how we can improve Chinese medicine. So when I talk about the classical information, it's not that we need to ignore everything after Han Dynasty, for example. It means that Chinese medicine only grew because it understood, and Chinese culture is based on that. They understand how to balance the tradition and adding layers of new information without removing or ignoring the traditional ones. Okay, so this is a reference I always like to mention. Okay, and at Faculdade Abramek College, we developed a method, we call it Canli method, and we integrates the clinical principles of Chinese medicine into the daily practice. And we base this on a deep understanding on how to use the traditional principles and how we can improve our therapeutic effects. And we can do it in the different branches. I mean, acupuncture, herbal therapy. And Canli, as I see tomorrow, there will be Professor Sanson also talking. And I was there once in the Yiching program. He teaches there. And Canli is the representation, the utmost representation of yin and yang. The thing is, we need to look at yin yang in different ways, different layers. So I like to introduce my friend here, the acupuncture model, and I'm a physiotherapist here in Brazil. And as a physiotherapist, I'm trained to look at the body this way, to look at the body, thinking about nerves, muscles, bones, and so on. When I learned Chinese medicine, I was trained to look at the body just considering the channels, the acupoints. But actually, if we look at the body as a yin and yang representation, we need to look at the whole body. We need to see the Western way of looking, but also we need to see and understand the Chinese way of looking. When I say yin yang on everything, is relating not just to warming and cooling or up and down. We need to look to everything, thinking and considering the yin yang transformation. So when we talk about Canli method, there's three principles: ping, a balance or level or equilibrium, tone as free flow or something that is not obstructed, and whole as harmony. So we need to find a way to balance yin and yang. And once again, we need to look at yin and yang like this, the representation of the Tai Chi, but we need to look at it as a three-dimensional thing. We need to look at it and understand that we are talking about up and down, left and right, front and back. We need to look as a 3D model, and then we can understand a little bit more of what the classical means when the classical information means when they say we need to balance yin and yang, we need to balance the different parts of the body. And we need to do it restoring the free flow on the channels when we talk about acupuncture, because a lot of people say we need to tonify, we need to disperse, we need to reduce, we need to move. But if we don't restore the free flow, we cannot tonify or disperse. We only achieve this by moving the qi through the channels, and we can only move if there is free flow. So tone is a really important concept. And after that, we restore the harmony in the body. So balancing yin and yang through understanding on how and where the problem started and targeting areas that can move the body towards the regular balance. Please understand that I'm doing this introduction in order to say that when I selected acupoint for the shoulder pain, it has all this thinking on the back of our heads, okay? So Nanjing 67, for example, Nanjing, the classic of difficulties, it says yin disease move to yang, yang disease move to yin. So if a yang disease move to yin, I can treat the yin part because the disease has already moved from that. So it's really an important information from the classics. We brought other information such as yang disease treat yin, yin disease treat yang. And once again, I need to understand it in a broad sense because, for example, Ling Shu, the part of Huan Tin 18, chapter 7, it says that we need to select point on the left to treat the right. This is yang to treat the yin. It also says that we need to select points above to treat problems below. This is also yang disease, treat yin. So when we understand this really basic and simple principle, we can and we should put that in practice. And once again, first month of Chinese medicine education or first week of Chinese medicine education, we learn about yin and yang. But during the whole program, there are so much information, and because we are Western trained, most of the times when we learn something, we replace that information by the new information, and then we replace by the new information, and goes on and on. In Chinese medicine, when we learn something new, we need to go back to the first information, and then we can improve, and then we go back, and then we can improve. But sometimes people forget about the most basic ones, which are yin and yang. So another thing that we need to recall is that when we talk about like classical acupuncture, if you can use this term as presented in Huang Di Nei Jin, it's actually a channel-based form of acupuncture. It's not as we see in most of the books nowadays, the TCM books, organs and viscera, or organs and bowels acupuncture. One friend of mine, Professor Stephen, he mentioned that for him, TCM acupuncture is textbook Chinese medicine. Textbook, not traditional, because actually it was created by the idea of standardization 60, 70 years ago. So when we talk about classical way of practicing acupuncture, we are talking about channel-based acupuncture. So here, when I'm going to talk about the single acupoint, and for me it would be much easier just to mention you guys the acupoints I use it, but we need to understand that it's all channel-based. It's not thinking about the relations through the Zhangfu. No, we are talking about channels. And nowadays, more and more methods or systems are being presented that highlight this idea of channel-based acupuncture, such as the Yijing acupuncture from Dr. Chen Chao. The master tongue acupuncture nowadays is spread all over, and I see some people, and sometimes I get a little bit sad because people say, oh, acupuncture does not work, but tongue acupuncture works. That's acupuncture. If you understand acupuncture, you see that the same information are presented in Huang Di Nei Jin and so on. And I'm just using tongue acupuncture as an example. What I mean is we need to go for the roots. Then we have balance acupuncture for Richard Tan, which studied master tongue acupuncture and studied Jin acupuncture. We have from the Japanese style Keiraku Chiryu, which literally means meridian therapy. But in all cases, the basis would be the same. Top for down, high and low points, right, left, yin and yang. It's all based on the classical information. And the combined application of channel theory with different systems of correspondence like holograms or microsystems makes you a little bit easier for you to find the most effective point. So here I'm just trying to represent in a simple way channels. Most of the times we look at them as some vertical lines. As you can see on the representation here, they're all vertical lines except for Daimai for sure. And when we talk about holograms or correspondence, most of the times we are talking about horizontal lines. So the best way for treating is that we find the most affected channel, and then we need to find which level of the channel is the best way, is the best area, the best part for us to achieve the effect. So that's where we can find an acupoint. So we need to find the channel, and then we need to understand in that channel what is exactly the best acupoint for treating. And then it comes this Chinese sentence: leave the point but do not leave the channel. Li xue bu li jing. You can sometimes do not be accurate in the point you have in mind. I mean, oh, I need to stimulate this acupoint number stomach 34, for example. But sometimes it's not possible to stimulate exactly that acupoint, but you need to understand that the channel is diseased. The channel has a problem. So you need to find in that channel the best acupoint. The idea here is not to say that, oh, you can do any acupoint, just you just need to needle the channel. No, it's not that idea. The idea is the channel is more important than the point. First, you find the channel, then you look for the acupoint. That's the idea, not the opposite. Nowadays, a lot of people start from the acupoint and then they think about the channel. No, we need to think about the channel, and afterwards, with acupoint in that channel would be the best option. Okay, so as shoulder is our topic here, shoulder joint is a complex articulation between different bones, such as scapula, humerus, and clavicle. And it has different joints that we in general call it shoulder joint, but actually there are 4 small joints that can be blocked. Remember the idea of free flow? When we say blocked or obstructed or with extra movement or less than movement, or that's all problems because there is no free flow or there is no harmony. So we need to restore this. If there is no free flow, there is pain. If there is excessive movement, that also can be a problem. Okay, and the shoulder joint has the greatest range of movement than compared to any other joints in the human body. So the more movement possible, the more injury also possible. So it's commonly injured during sports, for example, like high impact sports, or they call it overhead movement sports, such as like volleyball or other sports that has a lot of movement related to the shoulder area. And a lot of houseworks, a lot of daily activities can injure the shoulder area. It's also affected by natural age-related degeneration of the soft tissues that goes around the shoulder area. And always when we talk about something in Western medicine words, as Chinese medicine practitioners, we can also think about in the Chinese medicine way. So when we talk about a joint that has small joints, we can think about the bone, we can think about the tendons, we can think about the soft tissue or the muscles around. So when you go for Chinese medicine, we need to remember about bones related to kidney. We need to remember about muscles related to spleen. We need to remember about tendons related to liver. And we need to remember that when we talk about tendons, it's not just tendon as the final area of the muscle, but tendons as different structures in Western nomenclature that goes around the articulation area or the joint area, such as the tendon itself, but also all the areas that goes around the fascia and so on. Okay, so analyzing the shoulder joint and its great capability of a range of motion, we can see that the primary source of movement at the shoulder is from the glenohumeral joint, and it's governed by a dynamic and static stabilizer consisting of bone, cartilage, ligaments, and tendons. So once again, bones related to kidney, cartilage, ligaments, and tendons has more influence towards the liver. Cartilage, some people also associate with spleen, but we can see that kidney and liver, they have a very great importance here. The clavicle serves to act as a strut for the axial skeleton, so it gets the joint really there together, and the scapula connects the humerus to the clavicle, assisting the stability and the efficiency of the movement. So they must work together, and as a joint that goes from the frontal area to the most posterior area, we can see that it starts from the clavicle and sternal articulation here, and it goes all the way. So when we just take a look at it and we compare this Western side with the Chinese side, we can see how many channels can influence and be influenced by this articulation. If there are so many channels related to this area, do you think that only one point can treat all kinds of shoulder pain? When we say single acupoint, we need to understand the meaning of that, okay? So we are going to talk about it. Shoulder pain is a significant problem in general population when we call Also, the non-specific shoulder pain. It has been described as pain without any clear defined pathology, and it's just started from activity. It starts from the use, and people get the increasing of pain, and this can affect their quality of life. So another term also used in Western terminology is painful shoulder syndrome, and can be characterized by the pain and functional restraint. I mean, there is pain and there is limitation on the range of movement. Shoulder disorder, it's important to know, are the third most prevalent musculoskeletal condition after spine and knee pain. So as acupuncturists and practitioners, a lot of the times, not most of the times, but a lot of times, we are approached by people with pain syndrome. So it's very nice to understand how to treat this. That could be considered the third most prevalent musculoskeletal condition. Shoulder pain is recognized as a disabling problem and is also a frequent reason for consultation in general practice. And it arises in or around the shoulder from its joints and surrounding soft tissues. It's typically characterized by symptoms in various joints, muscles, tendons, and the bursa, which tries to avoid some impacts, but when it has some inflammation, it also becomes the cause of pain. The onset of shoulder pain is variable and can occur with no direct cause. That's the thing that people sometimes cannot really understand what's going on, but there is pain for the patient. Also, it can be related to trauma, repeated movements, and some neurological events such as stroke. When the stabilization of the joint is affected and some muscles must act, and when they act, they can be overacting and then they become painful. Often causes short-term activity limitation and less frequently it develops into chronic condition. And people, once again, as I mentioned, it can affect the quality of life as the daily activities are restrained. The specific symptoms of shoulder pain can vary considerably, and when shoulder pain is really severe, it may radiate to different areas of the body, and it can go through the upper arm, the back, it can go through the elbow. The information most of the time says that it limits on the elbow area, but sometimes there is the shoulder hand syndrome, so it can also spread all the way to the hands, all the way to the fingers. And other symptoms can be weakness, limited motion of arm and hand, difficulty in dressing, difficulty in performing work at home, at the workplace, interrupt sleep. So there are many other conditions that can be present when we say shoulder pain. It's a common presenting concern in outpatient medical practice. And once again, it also reflects in the acupuncture clinic. Shoulder problem can significantly affect the patient's ability to work and to do their activities of daily life. And this can be really bothering for the patient and can cause by structures within the shoulder or some problems external to the shoulder. When you talk about treatments in the Western medicine, the biomedical world, if I can say that, the most common methods are anti-inflammatory or steroids injections, exercise, physiotherapy, sometimes just wait and see in a way that it can go away by itself. It has been shown, for example, that exercise is effective as regards the short-term recovery for the rotator cuff lesions. Moreover, the combination of mobilization and exercise provide additional beneficial effects. And here I shall say that acupuncture can really help the patient when combined the use of acupoints and exercise. And we're going to talk a little bit later about this, but the use of distal acupuncture points and exercise is really, really important. So now turning the page into Chinese medicine, the most classical ancient description of obstruction disease that most relates to the idea of pain in a joint is called Bi Ping or Bi Zhen. There are texts in the Western that in English that say B, disease. Some other text says B, syndrome. Most of the times I prefer to say B, disease, but I understand a lot of people say B, syndrome. And it can be found in the chapter 43 or 430 chapter of Su Wen, which is actually named the discussion of B, Lun. And all the chapter explains how B syndrome or B disease develop and how it can be associated with different pathogenic factors, how it can be associated with different structures in the body, tissues in the body, and afterwards how it can be associated with Zhang Fu. So if you want to really treat B disorders, we need to look again and again to chapter 43 of Su Wen. So based on the classical description and understanding of B, once again, B, Wiseman translates it as impediment or obstruction. It means that something is not moving, not flowing properly. It has some kind of obstruction on it. So B syndrome can be easily inferred that the most common conditions affecting the shoulder joint, especially associated with pain and limitation of range of motion. And in this case, we're talking about Jiang B, or the B of the shoulder B. So based on classical reference, shoulder can be referred as a union of wind, cold, and dampness. This is the classical definition of B syndrome, the combination of three qi, three kind of pathogenic qi, wind, cold, and dampness. When they are combined together and when they are affecting the joint, they can obstruct the flow of qi and blood, then it can turn into heat. So the inflammatory view in Western is because these pathogenic factors can turn into heat. So another way that we can see on chapter 43 to classify the B syndrome is related to the tissues. So shoulder pain can be some kind of Jing B or tendon B or Ji B, the muscle B. So tendon or muscle B can be considered the most kind of B related to shoulder problems. And shoulder B in Chinese medicine also can have different names. Chinese medicine has some specific terms presented during the classics, like pain in the shoulder in a general way, pain in the shoulder and back, congealed shoulder or frozen shoulder, 50-year shoulder, leak shoulder wound. So different names throughout the channel, the classics of Chinese medicine related to the idea of pain and limitation of range of motion. And the acupuncturist shall be alert to the minimum details related to the disturbance of the flow of qi and blood in the channels. And when we talk about treating any kind of disease, the Chinese medicine normally use mainly from the 50s to now, we say we need to do bianzhen lunji, we need to do channel differentiation in order to establish the treatment. And when we talk about the treatment of pain, we need to do Jingluo Bianzhen. This is the most important way of syndrome differentiation for acupuncture. I mean, the channel and collateral syndrome differentiation. And we can call it the Bianjing, or instead of differentiation of syndrome, we talk about differentiation of channels. So Wang Zhuyi, for example, the late experienced practitioner from Beijing, which advocated a lot of the channel palpation, he always mentioned that we need to go back to the classics and we need to palpate the channels to find the most effective points to understand the situation of the flow of qi. And he mentions chapter 75 of Ling Shu, before using needles, one must first scrutinize the channels to determine excess or deficiency. We need to palpate, we need to separate, we need to understand, and then we can find the channel, and afterwards we can treat it. And when we talk about channels, this is just a representation here. We need to look at it in different layers. From the most superficial one, we have Pipu, the cutaneous zone. But we can go further. We have the luo, the minimal luo, we have the grandson luo, we have the blood luo, then we have the tendon channels, then we have the main channels. So we need to understand that channel is not just like, oh, here we have the lung channel. No, we need to understand there are layers. This way we can treat different patients and different situations. So Jinluo Bianzhen primarily aims to understand the signs and symptoms that can show up along the path of the channel. And once again, not just the external path, but also the internal path. This is why we need to look for the channel to understand the situation of the patient, not just on the outside, but also on the inside of the patient. And in order to help to achieve a better understanding, we need to first review, comprehend the physiological functions of each channel and collateral. We need to go back to the classical information. If you are practicing herbal medicine, herbal Chinese medicine, you do not need to go as deep as I'm mentioning here. But if you practice acupuncture, we need to really understand all the branches, all the connections of the channels, because that's what we do in practice. We regulate the flow of qi through the channels. So for this reason, it's essential for the acupuncturist to have the pathways, internal and external, of each channel memorized and the functions and indications totally understood. Here is just a diagram of all the possible, or not all, but a lot of connections between channels. So if you just get one channel, we see that they can be connected with different channels, and we can use these connections to treat. That's why a lot of systems nowadays talk about, for example, the Richard Tan balance system talk about the system 1, 2, 3, because they're talking about how the channels connect to each other. But once again, we can go back to the classics to find this information, and you can write down chapter 10 of Ling Shu is the most important chapter for understanding channel and collateral. Chapter 11 is the most important one to understand the so-called Jinbie or divergent channel. Chapter 13 is the one for the muscle tendon or the tendons channel. So each chapter here, 10, 11, and 13 from Ling Shu are really important to understand layers or ways of moving the qi in the body. Okay. And now talking about the shoulder area. So when we talk about a pain that is related to the shoulder and related to the lung channel, hand tie-in channel, this pain is more anterior. So it limits the forward flexion of the shoulder. And it can reflect on the thumb because we understand the flow of this channel. So when we do this movement here and it's limited, we can think about the lung channel. Number 2, the Han Yang Ming, the large intestine channel. It's a little bit more lateral. It's still anterior, but lateral. So when we have like adduction movement, we can think about this large intestinal channel. We also can think about the Han Shaoyang or the triple burner channel. It's a little bit more further moving from the anterior area and circling the shoulder. So here is the lung channel, then we have the large intestine, then we have triple burner. So we are moving backwards. Number 4, we had Han Taiyang, which is the small intestine channel. It's a little bit in the back. But also we have a pain related to the Han Shaoyin, which is the heart channel, and it reflects on the axillary area, because that's where the external pathway of the heart channel starts. We also have combinations of lung channel and large intestine channel, which reflects in the frontal lateral area of the shoulder. But also have the 3 yang channels, so it's a little bit broader pain. And we have the Han Tai-Yin and 3 yang channels, so yeah, it's a little bit further. And here I just presented 8 possible associations of the shoulder with channels, and I made it only through the so-called external pathways of regular channel. When we go further, for example, talking about Chichimpamai or the 8 extraordinary vessels, we have different vessels going through the shoulder. We have like the muscle tendon area of the bladder channel going through the shoulder. So here I'm just talking about the regular channels, but there are other levels that we need to consider. So when we look at a joint such as the shoulder joint, we need to look at it and closing your eyes or not, it depends on how you practice, but you need to see the channels, not in a shamanic way or divinatory way. We need to see the channels as a reflection of your understanding of the relation of each area with the part of the body you need to treat and which channel pass through it. Okay? So, So acupuncture is an effective and proven treatment for different kinds of pain. So throughout the history, different methods also have been applied for treatment of shoulder pain. Very few studies have been conducted here in Brazil, which related to shoulder pain, which might have some specific characteristics. So, as we must know, there are many different options of treatment of shoulder pain in acupuncture. For example, we can do local needling, distal needling. We can do penetrating needling. We can do microsystems. We can do balance acupuncture, tongue acupuncture. There are many, many different options. And one interesting option that I recommend, not just for shoulder pain, but for any kind of joint pain, is the selection of distal acupoints and the active movement of the joint. If active movement is not possible, the passive movement. Oh, but this is called distal acupuncture. Nowadays, people are using names for everything. Okay, we can call it distal acupuncture, the selection of distal points. If you go to Lin Shu chapter 7, there is one method called Yuan Dao Zi. It really means distant path needling, distal acupuncture. Okay, so independently of the method, it's always important to stress the need for an accurate bianjing or channel differentiation in order to select the most effective points. So for the research I conducted, it was a very simple research, and I'm going to present it here. Very basic. And the idea was to compare the efficacy of using single acupoints on shoulder pain. And we evaluate the range of motion, the visual analog scale for pain, and so on. And mainly we compared, can single acupoint immediately improve shoulder pain? Which is more effective, local points or distal points? This is where the questions we had in mind when we did this. So the present study was conducted in São Paulo, Brazil, with subjects from the acupuncture outpatient clinic of Ebramec. And it was approved by our ethics committee, and also it was a part of the PhD requirements from Shandong University. Okay, so 75 patients were randomly assigned to 5 groups with 15 each for one treatment only, and we had 5 acupoints. See, the idea here was to see that if one point can be a general point for shoulder pain, but when we go look further, when we select the best acupoint, connect to the best channel, then the effect really appears. So large intestine 15, stomach 38, Shanguan, which is an extra point from Tongxue tissue, the master tongue acupuncture, gallbladder 34, and triple burner 2. So Jiangyu, the large intestine 15, it's a very famous acupoint for shoulder pain. Actually, the name Jiangyu means shoulder point. And here we selected this point based on the principle, and actually all the points were selected on the basis of opposite needling. So it's called the left and right acupoint selection. So if they had pain on the left shoulder, we treated the right shoulder because it was the best way to check the efficacy of the treatment with the needle still in place. A second acupoint was stomach 38. It's located in the lower part of the foot Yangming channel. So we have the connection of foot Yangming to hand Yangming. So we have the connection related mostly to the large intestine area on the shoulder. But here, normally, we use the called touci, the penetrating needling, and we go from stomach 38 to bladder 57. See, we are doing a connection of a Yangming to Taiyang. So when we go for the shoulder area, we have the Yangming in the front, represented by the large intestine, and we have the Taiyang on the back. So when we do the needling from stomach 38 to bladder 57, it would be the same as needling all the way through the joint. Can you see this? All the way through the joint, from the Yangming to the Taiyang. Shengguan is, as I mentioned, a point from master tone lineage of practice. It's related to Shengguan, really means the pathway or the some kind of gate of the kidney, and it has some effects on the kidney itself, but actually it's on the spleen channel. It's in between the spleen 8 and spleen 9 acupoints, as you can see on the picture, and the effects can lead to improving the condition on the shoulder. When we talk about the relation to kidney, it goes through the idea of stimulating the bones. When we go through the idea of spleen channel, it relates to the lung channel also. Another acupoint that is very famous and used for shoulder pain, and we use it in our research, is gallbladder 34. Besides being an interesting acupoint, from the Nanjing on, it's being associated with muscle and tendons as one of the Hui or influence acupoints. And there are some different systems, such as the balance acupuncture, not the Richard Tan, but another kind of balance acupuncture that has the shoulder pain point that you need to palpate in the area of gallbladder 34, and then you find the most painful point, and this is the most important point for treatment. And finally, triple burner 2, that could treat the area related to the triple burner channel. And when we go deep needling this acupoint, we go from triple burner 2 through triple burner 3. When we do this, we connect the second and third acupoints, and when we go for shu acupoints, we connect the yin point to the shu point. And this idea is also mentioned on the classics as a good combination for pain. So there are different strategies here. We try to select some acupoints on different parts of the body to check the efficacy. So as I mentioned, this is to present an idea, okay? So the inclusion criteria: age between 18 to 70, diagnosis of shoulder pain, did not participate in other ongoing clinical studies, and sign an informed consent. The procedure: proper body posture for using the needle, and also the allowing the movement of the shoulder. That's why we did opposite needling. So we did the routine disinfection for clear needle, and we used the 0.25 40 millimeters acupuncture needle. During the data collection, just evaluating the channels that were most affected when the patient described the area that was most painful, we can see that for the females, 24% related that large intestine was the most painful, and for the males, the triple burner channel or sanjiao was the most painful. Okay, this is just an information for us to consider the possibilities, but we see that most of the times for the male and the female, it's either large intestine, a small intestine, or triple burner. A combination of them can also appear, but not as frequently as they appear independently. Okay, so here is the results of the 5 groups. So we have the minimum and maximum level of pain presented by the visual analog scale. This is before treatment. We can look for the median or the average pain presentation, and this is a visual representation of what we presented on the previous table. And this is the after treatment, when we can see that we could really reduce the level of pain, and this is a visual, once again, visual representation. And this is a comparison of reduction, and the channel, the acupoint that present the least reduction was about 56 or 57%, and it was large intestine 15. We see that they were all very good and statistically significant on reducing pain when we did the comparison before and after. It was, as I mentioned, the evaluation of the immediate effect, so there was no follow-up of the patient. We tried to see that one needle at the specific acupoint could present an immediate effect. This is the comparison before and after between each of the groups, and as I mentioned, all had a very good impact. Despite of the limitations of this clinical trial, and as I mentioned, one of the limitations was no follow-up. We did not consider different criteria for diagnostic. We mainly evaluated the pain and the needling and how effective it was or not. But despite the limitations, it was possible to conclude that a single acupoint intervention can be immediately effective to improve the pain and range of motion. This is really interesting for using in the emergency settings and also, for example, in sports medicine. Further studies are recommended, including those based on randomized control trial with larger sample, longer intervention, a comparison between different groups. But we need to say that this was the first research of its kind in Brazil relative to evaluation of immediate effect of a single acupoint for shoulder pain. And I'd like to say thank you very much. 谢谢, or 非常感谢. Muito obrigado. For those who can speak Portuguese, I see a friend from Portugal as well. And dear friend Robin, I hope I did not go over the time you allowed me to share some of my information. Thank you very much. And if you guys have any questions, I'm